Asbestos is a naturally occurring mineral that is used as an insulator and fire retardant. The mineral forms in fibers that can break off and become airborne. In the early and mid portion of the 1900s, people living near asbestos mines could inhale airborne fibers and asbestos dust. People working in asbestos-related industries like shipbuilding, boilermakers, brake mechanics, and building contractors inhaled the fibers at work. Research established the dangers of asbestos by the 1920s, but few regulations were put into place until the mid-1970s. After the government implemented regulations, enforcement was not consistent. Today, asbestos is still used in many industries and in other countries. People who are careless about wearing respirators or who are unaware of the presence of asbestos can still get work-related asbestos exposure. When the asbestos enters the body, it moves into the lungs. Once in the lungs, asbestos is harder for the body to remove than many other contaminants. Over time, the irritation of the lungs causes scarrings that can be a precursor to cancerous growth. Cancer is the abnormal division of cells within the body. As the cells divide, they form masses or tumors in the affected area. The two most common types of lung cancer are small cell cancers and non-small cell cancers. Mixed cell cancers occur much less regularly. Cigarette smoking causes most small cell cancers. When a doctor diagnoses a patient with lung cancer, it means the person has tumors in one or both lungs, most frequently near the trachea. The presence of the tumors makes it difficult for the lungs to function properly. When abnormal cells first appear in the lungs, there may be no symptoms at all. By the time the symptoms begin to show up, the cancer has had time to develop, and if not caught quickly, it can potentially spread to other parts of the body. The symptoms of lung cancer include a cough that won't go away, or changes in a persistent cough, being out of breath, pain when coughing or breathing, coughing up phlegm that has blood in it, and unexplained loss of weight. There are other less common symptoms as well, but things other than cancer can cause all of the symptoms, whether common or not as common. Identification of risk factors and elimination of other easier to spot illnesses guides a doctor in whether to suspect cancer. Regardless, successful treatment of any medical condition is more likely with early detection. Therefore, a person with any of these symptoms should consult a doctor. To determine whether a person's symptoms are caused by cancer or something else, a doctor may use CT scans, X-rays, or MRIs to get a better look at the lungs. The doctor may also use a microscope to examine any phlegm the person may cough up to determine whether it contains abnormal cells. Since cancer is often asymptomatic in early stages, it is frequently discovered when the doctor is actually examining the patient in relation to a different and unrelated medical issue. The role of asbestos in lung cancer has proven difficult to quantify. Lung cancer caused by other factors like smoking and lung cancer caused by asbestos look the same under the microscope. Asbestos is the only cause of mesothelioma and asbestosis, both of which also affect the lungs, but which are distinguishable from asbestos-related lung cancer. Lung cancer has many potential causes, so identifying asbestos as the cause in any given case requires elimination of many potential contributing factors. One distinguishing characteristic seems to be a pattern of asbestos-related lung cancer occurring at a younger age than other types of lung cancer. Furthermore, studies in Great Britain have shown that in populations that have known asbestos exposure, the lung cancer rate equals or exceeds the asbestosis and mesothelioma rates. Their rule of thumb indicates that for every one mesothelioma death, 2 people died from asbestos-related lung cancer. Researchers know that the chance of getting lung cancer from asbestos increases with the duration and intensity of exposure. Smoking increases the lung cancer risk still further. For those people who have been exposed to asbestos but not yet developed lung cancer, quitting smoking reduces the risk. After a doctor has made the lung cancer diagnosis, treatment is the same regardless of what caused the lung cancer. Treatment depends on numerous factors, including where in the lungs the tumor is located, how advanced the cancer is when detected, and the patient's overall health. In some cases, surgery can remove all the cancerous tissue, curing the disease. Unfortunately, doctors can't perform surgery on all tumors, and it doesn't help if the cancer has spread throughout the body. Radiation therapy uses very strong X-rays to attack a specific area where cancer cells have massed. It may be used to kill cancer cells in some locations and can help treat symptoms from lung cancer. Chemotherapy involves targeting the cancer with drugs that prevent the cancer from multiplying. Frequently, radiation and chemotherapy are used together to form a more powerful treatment than either could be individually. Treatment options continue to advance as doctors and researchers conduct more clinical trials. In March of 2007, results from a new clinical trial showed that while surgery is an effective option for cancer in early stages, it does not improve survival rates more than combined chemotherapy and radiation treatment for people with advanced stage 3 cancer that has spread into the lymphatic system. Other clinical trial results published this year include findings that one drug seems to have more favorable results in chemotherapy trials than another similar drug, and that using less intensive radiation treatment for a longer period of time had better results than short-term high-intensity radiation. In addition to these trials, where results have already been published, more than 500 clinical trials involving lung cancer still are accepting new patients. Thank you for watching. This video was produced by Asbestos.net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.